Thank you. Good afternoon, everyone, and welcome to today's office hours session entitled Don't Lose Track, Complete and Compliant COVID-19 Vaccine Tracking Tools. I'm Teresa Mandela, a Quality Improvement Advisor with the Health Quality Innovation Network, or HQIN. Today, I'm pleased to be joined by Mary Lachlan, our Certified Infection Preventionist, and also Allison Spangler, Quality Improvement Advisor and MDS expert, who is manning our chat and logistics. Our goal at HQIN is to assist nursing homes in Kansas, Missouri, South Carolina, and Virginia with quality initiatives at no cost to your facility. Before we get started, let me review a few housekeeping items. Everyone that's attending is currently muted and in listen-only mode. If you have questions or would like to comment, please use the Q&A icon at the bottom of your screen. The presentation and today's vaccine tracking forms and tools will be provided via a link in chat. That's the most popular question we get. So if you're looking for the tools we're talking about today, please go to the chat bubble, click on it, and you'll see links to the resources. Today's session is also being recorded, and you will receive a link to the recording within 24 hours. At the end of today's session, there'll be a very short evaluation, and we appreciate you taking the time to complete it so we may serve you better in the future. Now, if you encounter audio challenges, please click Audio Settings in the bottom left-hand corner of your screen. And if you're listening by telephone, options are in your confirmation email. So let's jump right into vaccine tracking and our objectives for today. They include accurate methods for documenting resident and staff vaccine status, because just having a list of vaccinated residents and staff isn't enough for your Infection Prevention and Control Program, or IPCP. And also, a list doesn't provide the specifics you need during a survey. We'll look at HQIN's vaccine administration and tracking tools, plus discuss using the data to identify trends and gaps in your vaccinations to date. We'll cover how these tools keep your documentation accurate, current, and compliant, while fitting right in with your QAPI program. They can also help you plan ahead for next vaccine doses. Because the tracking tool will show you has built-in formulas and summary charts and graphs, you'll be able to see at a glance where you are in your vaccine journey and where you want to go. Using a data-driven approach helps you and your team strategize and develop effective game plans. And lastly, many of you are already reporting vaccinations into NHSN, or you're interested in learning more about that. The HQIN tools not only can assist you in completing the weekly NHSN reporting module, but they also give you additional information you'll find useful in managing vaccines within your building. So let me ask, how are you all tracking vaccine administration in your facility right now? I can tell you, we're hearing answers across the spectrum. A few nursing homes are using incredibly sophisticated tracking, and others have received a piece of paper that's nothing more than a resident roster with check marks that they got from the pharmacy that ran their facility clinics. So think about this. If a surveyor or perhaps a health department official walked in your building today and immediately asked for a comprehensive listing of every resident and staff member that's been fully vaccinated with dates of vaccine administration, would you have total confidence in your rapid response? How would you fare when they asked for a list of every single current resident and staff member who has not received a vaccination? Or a list of those who have had vaccine number 1, but refused vaccine number 2? How many have received just a single dose of the Janssen J&J vaccine versus a Moderna and Pfizer? Who had adverse events? When did they have them? Who administered those particular vaccines? What lot numbers were used? Who is keeping track of when the next doses are due? And then what about visitation? Now we need to have 70% of residents vaccinated for indoor visits. So how are you tracking your rates as residents are admitted and discharged? Now that the National Pharmacy Partnership clinics are ending across the United States, many nursing homes will be using their long-term care pharmacy for vaccinations. There could be a mix of people giving vaccine injections, from pharmacists to outsourced nurses to your own nursing staff if requested and approved by your pharmacy or your facility. You're going to want solid documentation of these vaccine administrations, whether they be residents or staff. We're going to show you a one-page vaccine administration form that can be used for each individual resident or staff member at the time of injection. These forms that we're going to show you are completely optional, and they were created to give you a documentation source just in case you need it. Okay, this is a viewing alert. We're about to show you several detailed forms and spreadsheets. The whole idea is to keep all the information that you need for compliance and vaccination tracking in one place. But what that means is it's really, really difficult to view on a PowerPoint slide during a Zoom call. So if you haven't received the tools already and downloaded them, please go to the chat bubble and see the links to today's resources. And now Mary's going to talk to you about the resident COVID-19 vaccination administration form.
Hi, everyone. The Resident Vaccine Administration Form is designed to collect all the necessary information to satisfy vaccine tracking of a facility resident. It's important for the person administering the vaccine to make certain all the information is complete, so the staff member designated to complete the tracking spreadsheet, which will be reviewed in upcoming slides, can pull the information over and submit that as appropriate. The top of the form asks for facility-specific information and resident-specific information. Moving to the vaccine information, the person administering the vaccine simply selects the appropriate box for the type of vaccine or writes in the name of other manufacturers as appropriate. The dose, if Pfizer or Moderna or any COVID-19 vaccine that requires more than a single injection, is also important to record. If a vaccine is administered, the lot number taken from the vaccine vial and the location on the body site where the vaccine was administered are completed. If the vaccine is declined, that will need to be indicated along with the specific dose. If the vaccine is contraindicated, the staff member completing the form can document a brief description of the reason. The CDC states that immediate allergic reaction of any severity to a previous dose or known diagnosed allergy to any component of the vaccine constitutes a contraindication to the vaccine. Residents meeting these criteria should be referred to a physician to assist with determination about receiving a COVID-19 vaccine. More detailed information can be found on the CDC website, and we have placed a link to that destination in the chat box. Also, the CDC states that any persons receiving the vaccine should be monitored for 15 minutes, and those persons who have a history of any allergic reaction to a vaccine of any kind or injectable therapy should be monitored for 30 minutes. Facilities must be prepared for a vaccine reaction per specific facility protocol and expedite a 911 response as necessary. Again, if the resident declined, the person completing the form indicates with an X and documents the date the vaccine is declined. If the resident received the vaccine at another location, it is important to capture as much information, such as the location, the date, and dose, as possible. The bottom section is to be completed by the person who is designated to capture vaccine administration information and includes the resident's history of laboratory confirmed COVID-19 infection and the date of any positive result. The last line is really just a reminder to ensure that a consent is on record for the administration of the COVID-19 vaccine. As you can see, the staff member vaccine administration form is very similar to the resident administration form. The team member's full name will need to be documented, as well as the facility name and the state, but the rest is identical to the resident vaccine administration form.
Great, thanks so much, Mary. Now, the vaccine administration forms are used for each individual resident or staff member. But in order to see the status of everyone in the building, all residents and staff in a single repository, we've developed a comprehensive vaccine tracking spreadsheet. I know you can't see the detail in the spreadsheet rows on this slide. So we pulled out the headers so you can see the tracking categories. And they're the exact same headers that were in the resident and staff vaccine administration forms, plus a few extras. So why would you ever want something this detailed? Well, because it's important to track each vaccination and its associated data in one place. You want to be able to know exactly where your vaccine program stands, who needs their next dose and when, and who still needs a vaccine. This provides a single at-a-glance view of vaccinations for the entire facility. So if you're looking at all these columns and beginning to freak out, please remember, you are a long-term care expert. You have already survived COVID in 2020. Don't let a detailed spreadsheet intimidate you. Now, the vaccine administration form that Mary talked about is used at the time and the location of the actual vaccination to create solid documentation. The information from that vaccine administration form can then be entered into the vaccine tracking tool, the spreadsheet. If you're already using your facility's own form to capture the vaccine administration, then the info you've collected on that form can be transferred to the vaccine tracking tool. You'll want to designate a person to do the transfer of information onto the tracking tool. Keep in mind that the tracking tool and the resident and staff administration forms contain HIPAA protected information. So keep that in mind when you determine who's going to be filling in the tracking sheet. Since the big vaccine clinics have already ended, now you may be seeing just 5, 10, or 15 vaccines given to your residents and staff on a single day in a week, instead of 50 or more at a time. Ideally, you should consider going back and entering the vaccine data for all current residents and staff who have already received 1 or 2 vaccines, plus any of those that have refused. This retrospective facility data should have been formally recorded somehow during the clinics or as staff were being vaccinated at local retail pharmacies or state sites. We're hearing sometimes that staff and even residents are coming to your building with their CDC approved vaccination card. And what are you doing with that information? How are you capturing that? So again, thinking, why would you have a designated person enter everything into this one vaccine tracking tool? Because you want to ensure you have a complete picture of your vaccine program. If you're ever required to produce very solid COVID-19 vaccination documentation, you will have it, and you can show it was used to monitor, analyze, identify, and plan relevant actions for your program. Now, I'm going to tell you, if you don't use spreadsheets in your everyday work, it can seem like there's some hidden surprises when you open up a spreadsheet like the vaccine tracking tool. If you try to add data into a row and then into a cell, and a spreadsheet won't let you type it in, look for a downward arrow to the right of that space. That means the spreadsheet's been pre-populated with menu options that drop down when you click the arrow. For instance, when you're entering vaccine administration information regarding staff members under the department column, you'll see a drop-down menu containing staff departments in alphabetical order. The tool breaks out departments into the following buckets: activities and recreation, administration, ancillary services, and other, which means environmental services, maintenance, dietary, laundry, consultants, licensed nurses, MD, PA, MP for physicians, physician assistants, and nurse practitioners. Then there's a bucket for nursing assistants. There's one for social services, and lastly, for therapy. When you're inputting vaccine data for a resident or a staff member in the tracking sheet, you'll enter the date of the first dose of their Moderna or their Pfizer vaccine. And one thing that's pretty cool is that this spreadsheet automatically calculates the due date for the second vaccine. So while we know clinically you've got some leeway on that date, the spreadsheet is going to show you the recommended 3-week or 4-week date after that first vaccine. Having this information in a single location makes it easier to coordinate and monitor pharmacy services to ensure their timely return for those second doses. It also helps you with discharge planning for your short stay residents to be able to see exactly when their next dose is needed. And for like the Janssen J&J vaccine, since it's a single dose only, the spreadsheet knows that and it populates NA in the second dose due slot. And I'll tell you, as other vaccines are approved for use in nursing facilities, we will update the spreadsheet and add those along with their associated second dose date calculation if that's needed. So isn't it nice? You'll have a tidy spreadsheet that you just saw of all these rows and columns with data. But I'll tell you, there's nothing like having a visual representation of your vaccine program. And when you enter the data of the vaccines administered and those also refused, the spreadsheet automatically provides you with summary graphs and charts like those on the screen for residents and for staff. These summaries do not contain identifiable resident or staff data, and therefore they can be shared with other internal team members as your facility policy allows. So I'm thinking like QAPI committee, the Infection Prevention and Control Program members, and attendees at pharmacy meetings. For instance, you can see numbers or rates of residents with fully completed vaccinations, residents who refused, residents awaiting second doses, and any adverse events sorted by vaccine type. Additionally, all in one spot, you can see the number of residents with a history of positive COVID-19 lab tests. And with the reopening of our buildings to the outside world of visitors, knowing the rate of completed resident vaccines can be helpful when you consider the CMS indoor visitation guideline criteria of having 70% or more of our residents fully vaccinated. Let's not forget about staff vaccination summary graphs and charts too. The spreadsheet automatically calculates staff vaccine uptake broken down by facility departments. And that's because it's beneficial to identify where there's vaccine hesitancy and where there's vaccine confidence within departments throughout the building. Seeing the departmental vaccination breakdown can help you target your strategies where they're needed most. And best practices and ideas could come from departments with very high acceptance rates. The spreadsheet also breaks down your vaccine administration rates by week, so you can track progress over time and see trend lines. The graph shows the total number of residents with vaccines fully completed, total number of residents awaiting a second dose, and the total of residents who refused the vaccine. And with all the tools and summaries we're showing you, residents are separated from staff on different spreadsheet tabs so you can track them independently of one another. The weekly rates we just talked about are also summarized numerically in a tabular view. And this summary view does not contain any resident or staff specific identifiable information. So what vaccine rate goals have you all set for your residents? What about your staff? Now that the major vaccine clinics are over, have you modified your vaccine acceptance strategies if you weren't exactly hitting the targets you desired? Using the vaccine tracking tool we showed enables you to utilize a data-driven method to improve your vaccine rates. As part of your QAPI program, you could even consider making this a performance improvement project or a PIP. Think about things like, what's the root cause analysis for low vaccine acceptance in a certain department? You could zero in and use tools like the AHRQ's brand new nursing home curriculum and facilitator guide that includes staff huddles and weekly activities to boost vaccine acceptance. If you haven't seen that, it's the AHRQ's newest Presenting Facts and Addressing Misinformation to Increase Nursing Home Staff Confidence in the COVID-19 Vaccines. Long title, really good resource. Increasing vaccine uptake deserves our continued attention with a targeted approach. So we would say, please use the vaccine tracking tool to help track your performance improvement project progress. And if you do something like this, never forget to share your successes with everybody. Well, it turns out that nursing facility infection preventionists aren't the only ones interested in tracking vaccinations among residents and staff. On March 26, the Senate Finance Committee made it clear to HHS that they are pushing to have nursing homes report detailed vaccination data to the CDC. That likely reporting mechanism would be, are you ready? NHSN or the National Healthcare Safety Network. Yep, once again. Think about this. If you are needing to report to NHSN and you don't know where to start, the HQuinn vaccination tracking tool can assist you in completing the weekly NHSN COVID-19 vaccination reporting module. We've included key items required by NHSN, but also given you additional important data that you'll want for your internal compliance records. We highly encourage you now to begin reporting your vaccine data to NHSN while there's still time to train and get used to the layout and forms for this module. It's not mandatory yet, but again, when you've got folks like the Senate Finance Committee asking HHS to do this, it's probably inevitable that it's coming down the pipe. We've included links here to the NHSN COVID-19 vaccination training slides, as well as the reporting module at the bottom of this slide, in case you'd like to familiarize yourself with it. And kudos to those of you who are already reporting. To make it easier, because we know NHSN reporting is complicated and probably not the most fun you've ever had, the HQuinn team is developing an additional spreadsheet tab that we will roll out next month. The new tab will pull over data from the resident and staff spreadsheets we showed you today into an NHSN format that can make it available for potential upload directly to NHSN. So stay tuned. We'll send out new notifications when that feature is available. And now Mary is going to speak to you.
Hello again. Next slide, please. So we developed a COVID-19 vaccine quick reference that highlights the differences between the Moderna, Pfizer, and Janssen COVID-19 vaccines. It includes just a few dosing, storage considerations, do's and don'ts, and links to the websites of each of the manufacturers. This was designed as a single reference source for you to keep handy, share with your clinical staff, and post conspicuously for everyone.
Thanks. All right, we're coming to the end of the session time. Allison, do we have any questions in the Q&A or chat regarding the tools discussed today?
Yes, we actually have one, and it's from Linda, and her question is, will these tools integrate into the immunization module of the main EMR system?
What a great question. The answer is not yet. And if you, Linda, would like to email us with the particular EHR that you're using, I'm thinking it may be PCC, we would love to talk to you about that because we are seeing different electronic health records having modules that are they're in different stages of development. Some we've seen are strictly really to capture the immunization and ensure that the time and labor and billing function can be done. Others are strictly clinical. We're seeing some that include things like lot numbers and others that seem to have not put that in there. So if you would like to email us, that would be wonderful, because we would like to talk with you more about that and get our analyst involved to determine if there is a way that we may be able to assist with that type of upload. Anything else, Allison?
Yes, and this is from Annette. She said, we would like to see it incorporated into American Health Tech charting system.
Love it. Pretty much same answer as before, that we would like to talk with you more about that to find out what the parameters are, to see if our columns in any way could match up our spreadsheet, to at least be an easy tool. I'm not sure that it could integrate directly, but hopefully we could capture information or show you how the information is captured, and then talk with AHT to see if they may be able to utilize the spreadsheet as well, because there would be some IT development on that end that would be required. But it's a great question. I can also tell you that one of the reasons we developed the tools that you saw today are because some electronic health record vendors are doing a really superb job getting ahead of the curve on that, and others kind of seem to be hanging back. And there was an outcry from several nursing homes we work with to say, help, we need something to bridge the gap until electronic health records are fully ready to accept all the vaccine data we have to enter, and to include things like prompts so we don't forget anything. So it's a great question, and we would love to follow up with you. Anything else, Allison?
And actually, it's not a question, but Linda did provide some a helpful comment. She said the primary EMRs in Kansas are PCC and Matrix, but there are several in CHSs.
Fantastic. Thank you very, very much. All righty. Anything else in Q&A?
So currently there are no new questions in Q&A. So I'd like just to remind the audience that if you do have any questions, please don't hesitate to type them in the Q&A box.
Great. Thank you. And wait, there's more. How could it be that when you look on Care Compare, which we all know used to be called Nursing Home Compare, and it tells the world that your facility's flu and pneumonia vaccine rates are nowhere near where they should be, and you know that's not correct. But I'll tell you, every potential resident's daughter-in-law plus state surveyors see that posted rate on Care Compare for your nursing center. So what can you do about that? Please join Mary Childs and Allison Spangler in 2 weeks on Thursday, April 22nd at 2 p.m. to learn how you can assess and even correct that issue. We have the registration link at the bottom of the slide, and you will be getting emails as well on that. And we also want to remind you that CMS is requesting that all nursing homes have your direct care and leadership staff complete the CMS targeted COVID-19 training for frontline nursing home staff and management. It's extremely important to put a plan in place to have all frontline and management staff complete the trainings, as CMS is tracking nursing home completion of this training module. Please reach out to your HQuinn state representative if you have any questions, or if you need assistance to access these trainings. The link is on the bottom of the slide. Thank you again for joining us today. Again, if you have any questions that weren't covered, please send them in, or you can reach out to us. Our emails and contact information is on the slide. And as a reminder, everyone that attended today will receive a recording of the session and a link to the presentation within 24 hours. Please complete that really short evaluation, because we do value your feedback. Thanks for taking time out of your busy schedule to join us. We truly, from the bottom of our hearts, appreciate your commitment to your residents and your facilities in these stressful times. Have a great afternoon.